according to a post office worker from Croydon who's been given the remedy by his grandmother in Ghana. It's called Yamoa Powder, and Jerry Yamoa claims it's so successful that asthma sufferers are throwing out their inhalers.
This is it, the bark of a tree that grows in Ghana. And Jerry Yamoa is importing it, he says, to cure the UK of asthma.
It's a totally natural substance that is made from the bark of a unique gum tree found in West Africa, and it contains no additives. I know it works because people that have used it have come back to me to say it's good. I've got letters to prove, and I'm still getting letters from people.
Jerry comes from a distinguished background. His father was tribal chief, but it was his grandmother who held all the medicinal secrets.
I remember as a boy, people in my village that suffer from asthma and hay fever came to her every Friday for this medicine.
Jerry still has his day job at the post office, and appalled by the number of his workmates who use inhalers for asthma or hay fever, he decided to try his remedy on them first.
When I took the herbal remedy, the Yamoa Powder, I took it for a whole month without failure, and then since then I've not had an attack of asthma for the last 2 years now.
I took it and I've not had anything since. No symptoms.
I just took one course of it and I found it was okay. There was no tightness of the chest, no itchy nose, no runny eyes or anything like that.
The results of this unscientific but nevertheless impressive trial were unanimous. They all binned their inhalers. From then on, Jerry tried to persuade drug companies to do proper trials. They're not interested.
I wrote to them and explained to them that they should take this product because it's unique and it's going to help millions of asthmatic sufferers. But I got replies that they weren't prepared to, pursue the matter.
He can, however, sell it as a food supplement, dissolved in honey and easy to take in tea, twice a day.
Actually really nice. Is sort of a woody taste. Not bad at all.
Whether or not Yamoa tea cures asthma, Jerry's grandma certainly gave good advice. The youngest person to die in their family was 90. She died at 107. In Croydon, this is Liz Wickham for London Today.
That sounds like a recommendation, doesn't it? Dr. Michael Rudolph is a consultant at Ealing Hospital's Department of Respiratory Medicine. What do you think? Could this be a cure for asthma?
Well, it certainly sounds interesting, but I think we've seen lots of substances like this in the past. Anecdote is very interesting. There may be something in it, but I think anything like this has to be put to a proper scientific test and make sure it just isn't having a simple placebo effect, like a dummy tablet or water or anything like that.
I'd expect you to be sceptical, Lucy. The medical profession always are, aren't you?
Yeah, we're always sceptical, but we've got a long tradition of many of our current medicines originally came out of herbs and plants and twigs and branches. That's where future medicines may come from, but I think they have to be assessed for safety and effectiveness in a scientific fashion.
So you don't approve of people throwing away their inhalers, in other words?
I think it would be risky to suggest people use an untried new treatment and throw away their conventional treatment.
Now, you're saying it might work because of the placebo effect, but isn't that just as valid as any other effect? I mean, if it works, use it, surely.
If something works, absolutely. The trouble with placebo effects is they don't carry on forever. And in terms of the underlying abnormality in asthma, they may make people feel better, but it's leaving the underlying disease undertreated, and in the long run that's potentially dangerous.
Because asthma is on the increase, isn't it?
It's certainly increasing both in incidence and severity.
Because of pollution?
Possibly because of pollution. That's certainly one of the things that's making it a lot worse, yes.
So what's your advice then to asthma sufferers? What should they do?
If given this new compound to try, or in general?
In any case, in general, what should they do?
I think in general to always take recommended medications. There are new treatments coming along all the time. Combinations of treatments are now very effective, and I think we should all keep an open mind about any sort of new complementary medicine which might have the potential to help some asthma sufferers.
All right, so a bit of Yamoa powder on the side might not go amiss?
Might not.
All right, Dr. Rudolph, thank you very much indeed.
Thank you.